Hi, good morning Kirsten. My name is Monica Karina. I'm your invigilator for the OET speaking session on the 3rd of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Kirsten Strauss.
And what is your candidate number, please?
My candidate number is 251800025.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why do you want to work in the healthcare sector?
A person who decides to become a nurse has some different reasons other than earning money to enter this field. This question gives me a chance to express my desire to help out individuals and how important the human life is for me. I believe that with this profession, I can make a difference and make people feel better. Seeing so many people in pain and misery motivated me to practice nursing.
Describe your former supervisor.
I am so happy to talk about my previous supervisor. I feel fortunate to work under her supervision. She was a mentor who made each incident an opportunity to make us learn, and a good leader who built a great team spirit within us. She was a competent supervisor with exceptional leadership qualities, who always maintained healthy interpersonal relationships. I have learned a lot from her.
Tell us how you work under stress.
In my previous job as a labor and delivery nurse, we occasionally had sudden increases in patients in the unit. Since we cannot return pregnant patients, I have learned strategies to manage these increases. While still ensuring that I am giving priority to patients, I'll write down the things that need to be prioritized in the L&D unit as well. Hence, we were able to handle up to 30 patients at a time.
How do you use organizational skills in your day-to-day responsibilities as a nurse?
When I am on duty, I try as much as I can to make patients comfortable. I see their needs and inform physicians about the problems they are facing. I also try to assure and empathize with the needs of the patient and his or her family, and above all, I fulfill every responsibility assigned to me in the best possible way.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, Monica. I am your attending nurse Kirsten Strauss here. Good morning.
Good morning, nurse.
Monica, I am here to check on your progress after the surgery.
Okay.
Could you please tell me how you are feeling after the surgery?
I am feeling tired, and my stomach is quite sore. I am also feeling sick.
All right. May I know about pain, and also whether you have uneasy feeling like throwing up, or anything related?
Yes, nurse, I feel the pain, and still no change. I feel uneasy as well.
Okay, Monica. Try not to be worried. These are normal symptoms after the keyhole surgery. And the point to be noted is that it is temporary, and not going to last for a long duration.
Okay.
I can reassure you that these are the side effects of the anesthesia. So there is nothing to be panic about. It will subside with time.
Oh, okay.
And considering the pain you are experiencing now, will be subtle shortly. Already the medication has been given, and it is the time needed to take effect. In case, if you feel much pain, or if you feel that the pain is worsening or not changing, the dosage can be increased if necessary, with the doctor's instruction.
That's okay.
Monica, please call me and let me know about changes in pain, or any sort of uneasiness you feel. The call bell is on your right-hand side.
Sure, I will definitely tell you if the pain changes, or if I start to feel worse.
That's perfect. Well, Monica, I will explain to you the next steps of the procedure.
You may please proceed, nurse.
Nothing much, Monica. The doctor will make a visit, and will check whether your condition is satisfactory.
All right.
And also, you will be discharged after 3 to 4 hours if urine is passed.
Oh, really?
Yes, it is. Are you happy?
Yes, I am.
All right, Monica, may I know, are you ready to eat or drink right now?
Nurse, I actually feel hungry and thirsty, but I am a bit worried about eating and drinking, because of the fear of vomit.
Your thoughts are really sensible. I can help you out with the ongoing worries you have regarding eating and drinking.
That will be of great help, nurse.
First, understand that no panic situation is there in your condition.
Okay.
Now, I will outline the possible after effects of surgery on the digestive system.
All right.
The common and major effects a patient could undergo after the surgery are bloating, flatulence, and at the most diarrhea.
Okay.
Bloating is usually caused by excess gas production, or disturbances in the movement of the muscles of the digestive system. And bloating can often cause some pain, discomfort, and a stuffed feeling. It can also make your stomach look bigger.
Oh, I see.
Flatulence is nothing but the intestinal wind that's passed from the anus.
Yes, I understand that.
So, what I insist on is that you start to drink. As you drink water, the body and the stomach get hydrated. It is important for settling the stomach. I hope you understand my point.
Yes, nurse.
That's good to hear, Monica. Also, consuming water will help you with recovery, and make you feel much more comfortable because of hydration. Hence, you can get a discharge, as I said earlier.
I got it, nurse. I will try to drink something.
I appreciate your decision, Monica.
Thank you. By the way, nurse, when I will have the stitches removed?
I am glad to hear the question from you. It shows your consciousness. Actually, Monica, the stitches you have got are dissolvable stitches. That means, the stitches will disappear within 2 weeks' time.
Oh, really? That's great.
Now, talking about post-surgery care, the wound dressings removal will be in 3 to 4 days. So, you should come back for a follow-up after 4 days.
Okay, nurse.
Monica, is the information about the stitches and dressings clear for you?
Yes, I am.
Great. By the way, may I know, is there anyone to pick you up from the hospital?
Yes, my mother is coming to pick me up.
All right. Monica, you also need a care at home for the first 24 hours.
My mother will stay with me until tomorrow.
That's perfect, Monica. I wish you a speedy recovery.
Thank you. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.